And welcome to Healthcare Sucks with this bushy-eyed, bright Wednesday, sunny at the moment in Oregon situation. With that, I want to jump right into it and bring you. I try not to do the I told you so moments because God doesn't like it when you have a big ego, and He will punish you if you act ignorant. Okay, so with that being said, I just want to bring it up to everybody that remember we're talking about getting a hold of our governments and getting monies prepared for when you are quarantined. This is in another country, but I've already heard, same as me, if you go back and watch my videos trying to get a hold of Wyden and little brain Governor Kate, there's no getting a hold of these people. There's no getting an answer. But this is already happening over where it started. So let's check this out.
And now they're homeless, living on the streets in the city under lockdown. That's according to this video circulating. They came to Wuhan to seek medical treatment, and now they're homeless, living on the streets in the city under lockdown. That's according to this video circulating online.
现在怎么吃饭？每天捡饭吃啊？你们捡饭吃啊？
The video shows an interaction with a couple while crossing the Yangtze River Bridge in Wuhan. According to the video, the wife has chronic tuberculosis and has been unemployed for years. Her husband had work in a nearby city. They are stranded in Wuhan. They said they sought help from the local community, but were denied help. And they're not the only ones who are struggling. In a video published on Peer Video, a Chinese digital news platform, a man whose surname is Wang said he lost his job after being trapped in Wuhan.
I have no money now to pay my loans. I can't get out of here.
On WeChat, China's Twitter-like social media platform, a group with 500 members share their experiences of being stuck in Wuhan. Some have lost their jobs, others risk losing their businesses, like Ayuan, who owns a small advertising company. Rental costs plus home and car loans add up to over $14,000 per month, 16 times the monthly salary in Wuhan. He said if the lockdown continues for another month, he will have to sell his house to survive. Prices of daily supplies also went up after authorities tightened control measures.
He will have to sell his house to survive, guys. What have I been talking about? And in addition to that, they're talking about food costs going up over there. They're talking about, how he had a job, don't have a job. Now he's trapped. The first couple, she has tuberculosis, chronic illness, which how many of us out there have chronic illnesses? Many. How many of us live on a fixed income? Many. How many of us live check to check? 99%. That was an easy one. Okay. And if you do have a little dab stashed, which the government don't allow us to have much, if anything, that gets sucked up in 30 days, probably, or less. I mean, you work your whole life to have something, and now it's going to get wiped out and taken away from you. No, I don't think so. I heard they voted on something today, a HR bill, which is a health bill. I haven't got all the details in, so I don't really want to comment on it. But my best guess, without commenting and getting in trouble, is it's going to be monies to the feds. Then feds are going to give it to the states. I did notice that little brain Governor Kate is requesting like $10 million. Where's that $10 million going to go, little Kate? Are you going to give it to the people when they get quarantined? You're going to pay their debts? Also, like I said on one of my videos the other day, Katie Tur of MSNBC asked the Lieutenant Governor of California. Some people are asking if they go to the clinics or to doctors or to a hospital and they don't have the money, how are they going to pay for it? And she wouldn't give an answer. So we are not getting told the answers while they're pumping billions of dollars in Wall Street to make it look good. So it's going up and down and staying above a certain mark, when in reality, Wall Street is getting ready to crash, guys. If they weren't pumping, they've been pumping money in for a long time. And the banks cut loans and all that interest and a bunch of stuff today again in the United States. I covered it the other day. They did it in I think it was overseas. I don't I I hesitate to even say. So let's watch a little bit more of this and we'll jump into some more of what's going on out there.
Wuhan residents are not allowed to go out to buy food. They can only order grocery items in groups and get them delivered to their door at a price several times what they used to pay.
Did you hear that? When you're in quarantine, even over there, you have to order it in groups and it gets delivered to your door at several times what it costs to go to the store. One more time, several times what it costs to go to the store. So our government has a responsibility to us to cover this. Period. They got billions of dollars they waste on stupid stuff all the time and send to other countries. It's time to take care of us. And I heard today that India, which makes a lot of our pharmaceuticals, is shutting the door on sending antibiotics and other medications over to the United States. They're not sending it out no more. We're in deep poo poo. Our government needs to get on it. Well, let's take a look at. There's a few other good things going on. Not good, but things we need to be aware of. We're not going to watch all this.
Case count in King County overall is 31 cases.
Dang it. Sorry.
Today's new numbers are 10 cases and 1 death. As you all know, this is a fast-moving situation, and we're getting information in real time. The information we provided to you is all the information we have right now on these cases. And as you know, we'll keep you updated with more as we learn it. If you have additional technical questions about what we provided you, one of our public
a preventive measure. So whether or not they test positive or negative, they will still go to a healthcare facility if they require to go to a healthcare facility because of their medical condition. It's good for us to know, but at this point, we assume that if someone is in that facility, they likely have been infected or at high risk for infection, and they're being managed as if they are. We'll continue to provide updates as we get new information. And I just want to remind again that COVID-19 can cause severe disease, as we see in the context of the life care outbreak, but that for many of us, the disease is mild and moderate. The vast majority of people do not require hospitalization.
Tapping it down.
Or medical care for that matter. And we do encourage people who have mild illnesses, please don't overload our area healthcare facilities. Please don't go to the emergency department. If you're worried about your health, please call your healthcare provider before you go in. We're now going to turn the podium over to County Executive Dow Constantine to talk about some measures that we are recommending to help individuals in the community decrease their risk of COVID-19.
Here's today's Fox 12 flash briefing. The COVID-19 coronavirus is now blamed for 11 deaths in the U.S., 10 in Washington and 1 in California. The CDC has confirmed Oregon's first case, a man who works at Forest Hills Elementary School in Lake Oswego. They say that initial positive test was indeed the COVID-19 coronavirus. Meanwhile, the school where he worked has been deep cleaned and is set to reopen tomorrow. Oregon has 2 more presumptive cases awaiting CDC confirmation on those initial positive test results.
With that, guys, I suggest if you get time, please call our government officials, ask them those questions. With that, we'll call this one a flash report. We'll be back to you soon with more healthcare sucks news on W19C. Stay safe. Don't forget to get some supplies. They seem to be going pretty fast. Thank you for tuning in and have a good day. And healthcare sucks!